Resting, bracing, medications, and even surgery sometimes don't help to provide long-term relief to patients with carpal tunnel syndrome. You might be here because you've tried those recommendations or have been told to avoid using your wrist and hand, only to have the pain reduced, but come back when you try to use your hands again. This is because your pain might not actually be carpal tunnel syndrome, and what many traditional doctors are treating misses the real underlying cause. I'm a physical therapist who has specialized in wrist and hand injuries for the past decade, and I've helped more than 3,000 individuals resolve their wrist pain without resting, bracing, medications, and most importantly, surgery. I started with professional gamers and have since expanded to start helping desk workers, coders, artists, musicians to finally get relief for their carpal tunnel pain. Today, I want to help you understand more about carpal tunnel syndrome, why many are behind in their understanding of wrist pain, and what doctors should actually be doing to accurately diagnose your problem. And finally, I want to provide a 4-step guide to actually fix your wrist pain. This video is going to start with the anatomy and physiology so you can understand a little bit more about carpal tunnel syndrome itself. Then you'll learn the real problem causing your pain and sometimes causing similar symptoms to carpal tunnel syndrome. I'll then move on to teach you what a proper assessment of the wrist and hand looks like, and end with that comprehensive 4-step guide to get you back to using your hands again with less pain and more function, and is what we have been utilizing over the past decade to help so many others. So let's start with an overview of the anatomy. The carpal tunnel is a structure at the wrist which has 9 tendons and nerves that pass through it. The bottom part of the tunnel are the bones, while the top of the tunnel is the ligament known as the transverse carpal ligament. 9 tendons run through the tunnel. 8 of them are responsible for bending the wrist and finger flexion, while the last one is responsible for bending the thumb flexion. And you can think of the carpal tunnel as a sandwich, with the tendons on the bottom, nerve in the middle, and ligament on the top. Carpal tunnel syndrome means compression of this nerve, the median nerve inside the wrist. And the traditional understanding of how this nerve is compressed or irritated is from ligament and thickening of the surrounding tissues of the tendon, known as the synovium. The repetitive movements and vibrations associated with the use of power tools was believed to cause friction between the sheath tissue, the bottom of the sandwich, which would cause inflammation and swelling. Additionally, there's evidence and it's believed that with these motions, there may be load on the ligament itself, leading to thickening of that ligament. So the bread on both sides of the sandwich can thicken, which can cause some of the following symptoms. 1. Pain and numbness along the highlighted region, numbness at night, and weak thumb muscles. And it's believed that inflammation is a primary process that leads to the thickening. Micro tears in the surrounding tissues causes some of the changes that lead to it becoming more thick. But does this really happen? A large body of evidence actually supports a non-inflammatory reactive tendinopathy model. Even though inflammatory processes might be present, the swelling does not come from the sheath or the surrounding tissue of the tendon. Instead, it actually comes from the tendon themselves. Changes in the cells lead to altered tendon structure and water retention. And tendons can only handle so much stress. So when they're exposed to more than they can handle with repetitive pulling movements, it can lead to short-term changes within the tendon that cause more fluid to be present. Remember the concept of the health bar. Think of your tendons and muscles as having an HP bar like a video game. Every time you're clicking or typing, you're gradually losing HP. And there are things that you can do to influence how quickly you're losing your HP, like having better posture or ergonomics. So instead of losing 4 HP while typing, you might only lose 1 or 2. And when you get to 0, that's when your tissues can become irritated and you feel your pain. And when you rest, stretch, massage, kinesiotape, heat, you can restore or recover your HP. But the bigger picture is the size of your health bar, which represents how much your tendons can handle and your muscular endurance. And again, when the tendon cells are irritated, it leads to more water being present within the tendon, and this can cause pain itself at the wrist. But also carpal tunnel symptoms if the tendon thickness changes and it begins to irritate the median nerve. The bottom of the sandwich becomes more thick temporarily, which puts pressure on that nerve. And additionally, when the muscles themselves do not have enough endurance to handle the repeated movements, it can lead to tightness, which can further irritate the tendons, causing more swelling. And in many cases, we've seen this nerve irritation is temporary, and if the issue was poorly managed over many years, it can lead to more severe and actual carpal tunnel syndrome, weakness of the thumb, and night-related pain. But the underlying problem within this is not the nerve itself, and it's not the ligament. It's the muscle tendon complex that was not able to handle the repeated stress that was applied onto it. And when we actually focus on treating the tendon, these are some of the results. Patrick, who's an artist in the games industry, took 12 weeks to recover completely. He had a chronic problem for 2 years, got the carpal tunnel release surgery, only to have his pain and limited function return in only 6 months. He's now able to handle 8 to 9 hours daily without pain or difficulty. Ezra, who had 3 years of wrist pain that was so bad it made it difficult to hold a pen, open bottles, and manage basic functional activities. He had to actually completely give up gaming. But after 6 weeks, he was able to play 3 to 4 hours consistently without pain and was even able to play 8 hours without any issue on a single day. Raymond, who also was dealing with pain for 3 years, had limited ability to use his mouse for more than 1 hour without pain. He saw several orthopedic hand doctors, 2 hand therapists who only focused on resting and bracing for treatment. But in just 4 weeks, he no longer had any issues with work, driving, and most mouse and keyboard games. And Austin, who's an app developer, who was able to resolve his issues in 8 weeks, even after months of PT, chiropractors, and other medical providers. So remember, the underlying tendon pathology can lead to carpal tunnel symptoms. It's unlikely to be the ligament or the sheath of the tendon, and is why rest and inflammation-targeted interventions do not work for long-term relief. And if the tendon is a problem, what should doctors be doing to actually confirm this? Here's what a proper wrist and hand screening looks like. When you go to your primary care physician, they might ask a few basic questions about your pain, whether you have numbness or not, inquire about what you do that makes the pain worse. Often the questions stay at that level of depth, and it might be supported with a few clinical tests. The Phalen's test, reverse Phalen's test, and this test places the wrist in a position in which there's increased carpal tunnel pressure. And based on the research, it's best used as an adjunct in confirming carpal tunnel syndrome, meaning supporting the entire clinical picture. Then there's also validated questionnaires, and these are specific questions that have been shown to accurately diagnose whether someone does have carpal tunnel syndrome. And they primarily focus on median nerve symptoms, night symptoms, weakness, sensitivity changes, and a few other tests. Additionally, you might be referred to receive imaging to check for nerve involvement, like a nerve conduction velocity test. And this is actually a pretty good workup and might seem comprehensive for the patient, but all of these are focused on the nerve and whether there's pathology with the nerve. And if a physician only evaluates for nerve symptoms and pathology, that's all they'll be able to diagnose for. And that's also all they'll be able to treat for. Hence the rest, brace, medication, and other interventions that seem to have such low efficacy for this population. And this doesn't even account for the beliefs, the contextual factors, the environmental factors, the lifestyle factors that might all be contributing to more overall use of the wrist and hand. Very few physicians will ask the appropriate questions that inquire about muscle or tendon-based symptoms. And that's not really their fault. I've actually written a long piece about this. You can check that out in the description. Proper screening means actually looking at all of the possible contributors to your pain: posture, ergonomics, lifestyle, physiology, psychosocial factors, environmental factors, lifestyle factors. The physicians, if appropriately trained in musculoskeletal assessment, should be asking questions about how the pain behaves. What's your pain at rest? How does it behave with activity? How does the pain feel after stopping the activity to assess your irritability? Does the pain improve with certain activities or positions? Is there associated stiffness? Tendons can improve with a certain level of activity, provided it doesn't exceed the capacity of what it can handle. And morning stiffness is also a common issue or symptom occurring with tendon problems. Performing resisted testing of the wrist and finger flexors can also help to identify if there's muscle and tendon involvement. And even performing isometric protocols to reduce pain. Isometrics can improve brain to muscle signaling that reduce cortical inhibition or cortical excitability, basically that brain to a muscle connection. Using an isometric protocol can actually improve the confidence that a tendon might be involved. And there's actually a lot more which can be done within the initial evaluation, but most physicians just don't have the time to do this. And again, this can involve understanding your daily activity in depth to make sure that there's more specific recommendations in what you might actually have to modify. For example, if you're currently working 8 hours a day at the PC, yet you spend around 50% of that using your mouse and keyboard due to pain. And within those 4 hours, you spend a max of 30 minutes typing, distributing that time so you don't cause more pain at the wrist. Then after work, you might use your PC and phone for a few hours. Understanding how much you're using your PC and phone and other specific activities that can influence your pain can guide the provider or doctor in telling you how much you can modify in the early stages of recovery, not just telling you to stop it all completely. On top of this, they should be evaluating your workstation and your setup. Is there a specific part of your ergonomics and posture that might be leading to more stress on your wrist and hand while typing? If so, changing it can probably give you 30 to 60 more minutes of comfortable use over each day. And then what about your beliefs associated with what is going on? That matters significantly as well. All of this needs to be a part of a good evaluation. You can think of it like a pie chart with all the possible contributions to a problem. Your posture and your ergonomics, your lifestyle and activities, your physiology, your cognitive and emotional components. A thorough assessment that considers all of these components are rare in our healthcare system. And even with some physical therapists who have typically far more time compared to physicians, this still doesn't happen. And if you've watched up to this point, this is likely an experience you can relate to. And this is why resting, bracing, and passive interventions do not work. Instead, what works is targeting the causes identified from a good assessment as I just described. So let's go over what actually works. If your carpal tunnel symptoms are caused by tendon irritation and your tendons are irritated because they don't have the capacity to handle the stress you're applying to it, then you have to improve your capacity or your HP bar. And again, we'll use the HP bar to really make it clear what you can work on. So step number 1 is build up your HP bar. You want to focus on building up the endurance and capacity of the wrist and finger flexors that you utilize to type, click, or grip the mouse. And this involves performing wrist and finger flexion exercises like the dumbbell wrist curl, rice bucket exercises, finger wall push-ups, the very grip, and all of these focusing on higher overall repetitions at 3 sets to 12 to 15. And knowing the exercise is one thing, but being able to choose the right weight and the amount to perform is another. The exercises might cause a little bit of pain or stiffness, but it should not lead to more overall pain. Inability to use your wrists and hands afterwards, or persisting pain that is elevated in the next few days. And if that happens, then that's typically a sign of overload. Regressing the exercises to avoid this is important when this happens. Determining the right sets, reps, frequency can be tricky, which is actually why we developed the troubleshooter in the first place. The troubleshooter helps you determine an individualized program based on where you feel your pain, in this case, the palm side, and provides you guidance on how you can set the right amount for your exercises as you go through your recovery journey. And while improving your HP bar is helpful, you can also control how much health you lose during the day by modifying how much you're doing your specific activity. So step 2 is modify, do not avoid. Find what activities are causing your pain and adjust them. For desk workers, this might be reducing the amount of time you're using your right hand with the mouse, swapping to the left hand for a certain part of the day, swapping to use another input device, leveraging voice control to type and handle what you need to do at the PC for a certain part of the day, reducing total amount of time spent using your wrists and hands, the combination of computer and phone use, and improving your posture and ergonomic setup so you're losing less HP per unit time. You don't want to stop or rest completely. This has been shown to make tendon and muscles more weak. The tendon loses its structure, the muscle tendon strength drops, kinetic chain function deteriorates, and our brain muscle connection is negatively affected. All of that reduces the size of our health bar, the opposite of what we want. Instead, you should be progressively loading, which is step 3, loading gradually. This means being patient to gradually increase the endurance of your muscles and capacity of your tendons. It takes time for your tissues to adapt, which means it takes time for your HP bar to increase. The 3-step progression typically involves A, low-level isometrics and stretching, which is gentle gripping, resisted wrist and finger flexion for early strengthening, but also reduction of pain. Stretching can also help with associated stiffness and to address any mobility deficits. This level is typically for those who have more severe or irritable conditions. If you feel your wrists and hands are really deconditioned after several years of that rest pain cycle, then this could be a good place to start. Or if you felt high levels of pain, more than 6 to 7 out of 10, or if it's sharp, after trying some form of wrist strengthening, then this level will be helpful for you, and it typically lasts for 1 to 2 weeks. Step B is starting to add isotonic loading, eccentric and concentric movements. Once you can handle basic levels of isometrics and stretching without flare-ups, you can test low-level eccentrics and concentrics. This involves dumbbell wrist flexion curls and the exercises listed above for higher overall repetitions. And you want to find the weight where you can do between 15 to 20 reps without causing a flare-up. And you want to progress that exercise until you can hit around 30 repetitions, then increase the weight. And once you're consistent for a few weeks, then you begin increasing your overall activity levels. And this can last anywhere between 4 to 8 weeks. Step C is continuing to progress and returning to your activity. Once you've built a base level of endurance, you can gradually increase your levels of activity. The goal is to increase your activity levels more each week until you reach the target amount you want to do. And this can take anywhere between 8 to 16 weeks, depending on your starting conditioning point and how you handle your flare-ups. As you progress, you will inevitably deal with flare-ups, which is step number 4, manage your flare-ups and monitor your function. One of the most important things to understand is that flare-ups are a part of your recovery, and how you manage them can be a difference between a short recovery, 4 to 6 weeks, or a long-term battle, 8 to 16 weeks. And so why do flare-ups or setbacks occur? Mostly because recovering from an injury is a learning process for you as a patient. You're learning more about your body, more about how your wrist and hand muscles and tendons respond to various levels of activity or load, understanding more about pain or the experience of pain, and what might influence it on a day-to-day and weekly basis. All of these variables can lead to situations in which we use our wrists and hands too much after we notice a larger reduction in pain. Or we happen to do something else with our wrist and hand, lifting, carrying, driving, that we don't realize also utilizes the same wrist and hand muscles. Or 3, we might have work or life stress that can increase our overall sensitivity of our pain. And lastly, we progress our exercises too quickly. And there's quite a few more reasons. But during these flare-ups, the pain will feel worse. It might even feel like how it was when you first began your recovery. And there are usually 2 paths you can take in this scenario. Scenario 1 is the catastrophizer. This person will think, here we go again, I'm never gonna escape this pain. I'm never gonna get better, and this is a serious problem that only surgery can fix. My pains keep feeling painful even when I'm doing everything right. It must be something else that's happening. I should just rest and stop using my hand because it'll make things worse. Maybe this isn't the right approach, and I should go back to what my other healthcare provider mentioned. In this situation, this individual fears that something more nefarious might be going on and focuses heavily on the pain. As a result, he or she might completely stop the exercises, aggressively rest, and maintain this for an extended period of time due to fear that something else is going on. In almost all cases, there's no other complicating factor, and we hold ourselves back with this doubt and fear. Not only can this increase our overall sensitivity based on what we know now about pain, but it also leads to less overall activity, which we now know the muscles and tendons need to develop its capacity. And this typically requires some good education from a provider or a physical therapist to guide them towards the right direction while also appropriately managing pain and beliefs around the pain. And depending on this interaction, it can either get the patient back on track or continue to extend out the recovery timeline. Scenario 2 involves a person that understands pain and recovery. And this person would think, I just overdid it with my exercises. This will probably last a couple days. I'll focus on managing the pain and doing as much as I can in the meantime. It's normal that my pain is elevated since I've been dealing with this for a while, and it's gonna go down if I stick with the exercises and plan. The pain is from my lack of sleep and when I used my hands a bit more yesterday. I overused it a bit yesterday since I was feeling good, and it's just a minor setback. I'm gonna be okay. In this scenario, the individual has properly attributed their pain to a specific behavior, activity, stressor, belief, and understands that the elevated pain is temporary. They remind themselves of the progress that they've made with their functional capacity, and rather than focus on how bad the pain is. And this is extremely important. The measure of progress should be on function, or how much you can participate in your activity, rather than how bad the pain is. because we know that pain can always vary day to day based on how we're feeling, what we're believing, or how much sleep we've gotten, or the amount of stress. So for example, an individual with wrist pain might only be able to type for 30 minutes before feeling 3 to 4 out of 10 pain. If this person takes a break, the pain will take several hours to reduce. After exercising for 4 to 6 weeks, the individual might be able to type for 90 minutes before feeling the same 3 to 4 out of 10 pain, and the pain goes back down to 0 out of 10 quickly. The pain itself might be the same and even worse at times, but the individual can do more. Function is a measure of progress, not pain. And I will repeat myself again, pain is an experience, which means it can vary heavily depending on certain contexts and environments. Now, we've seen this thousands of times over the past decade and have applied this model to help these individuals get back to doing what they love. This is not just anecdotal. It's really how we've helped so many get back to 100%. And we've published studies, textbooks, accredited courses, and even presented at medical conferences so we can help more providers understand how they can treat RSI issues through the lens of esports rehabilitation. So as a brief overview of what we covered in this video, your pain is real, but the diagnosis and treatment approach might be wrong. If you've been told it's carpal tunnel syndrome and nothing's worked, do not give up. You might just need the right strategy, the right loading, and the right perspective. I hope this helps, and if you guys want to learn more about RSI and the science of how to actually recover, similar to what we've gone over in this video, check out this video right over here.